NP or CRNA? How do you choose? This actually stems from a "Hey Sean" question from the tribe. Someone asked, as an NP, do I wish I would have become a CRNA? What? At first I was a little offended, and then I realized that maybe this particular tribe member, this particular nurse or nurse-to-be, is trying to figure out if they want to be a nurse practitioner or they want to be a nurse anesthetist. NP, CRNA. I too had that same conflict. I too was at odds when I went back to school, got my BSN, and was ready to move on. I have lived in critical care my entire life. Everyone that I worked with, including the anesthesiologists and nurse anesthetists who I worked closely with in multiple facilities, they all said, "Sean, you definitely got to become an anesthetist. You were meant to do this. You'd be great at it." Not to mention, I mean, let's be serious. We all know that the CRNA position is probably the highest paid advanced practice role for a nurse. If I'm not mistaken, the starting salary is definitely 6 digits, 110, 120K, some crazy number. And that varies on geographic location. Needless to say, there's no argument, CRNAs make more money. But as I've said before, you should never do any job, take any position just for the money. The money will never be enough. You'll always want more money. I don't know an individual that would say, "Oh no, please don't give me more money." Money will help you with your happiness, but it will not bring you happiness. Also, many jobs, while pay is awesome, are the crappiest job known to man, or you're unhappy in some way. You want to pursue a degree, a vocation, a profession, a role that you are going to be happy doing day in and day out. Something that you can do every day and not lose the passion, not lose the joy, not lose the fire. And that's difficult to answer because you have no idea since you've never actually done either one of those jobs. You have to take it on faith and a little bit of research, job shadowing, talking with people. But at the end of the day, you need to figure out what's going to make you happy. Can you see yourself doing that job every day? Eliminate the pay. Forget about the pay for a moment. Trust me, forget about the pay for a moment. And think about the daily grind. You're going to show up to work every day and you're going to do that particular job. What is about the job that interests you? What is it about the job that you have no interest in? Pros and cons. What's negotiable, you could live with it, and what's non-negotiable, that you couldn't do it no matter what, it is something that is just a cutoff for you, a hard stop. And that's how you guide your answer. For me, when I graduated and was ready to move on to the master's level program, was at the T in the road, had to go left, had to go right, job shadowed both of those roles because I had worked closely with both of them. And at the end of the day, I realized that no matter how great the pay was, that being a CRNA would be monotonous to me, that I would not be happy. Would I be good at it? Probably. I love critical care. I love thinking on my feet. I love the high adrenaline. But I also don't like repetition. I don't like doing the same thing over and over again. No matter how exciting that is, I like variety. I like the challenge of difference. And I quite honestly, I love the bedside. I really do. I might complain about it. I might say a few choice words, but I love the interaction with patients and families. I love seeing the improvement. I love being able to elicit an intervention, seeing a response, and seeing if you can improve them. You're not going to get any of that as a CRNA. You're going to get them in slivers, but you're not going to be able to walk your patient from beginning to end. You're only going to see them for a slice. And 85% of the time, you're not even going to be talking to them. You're just going to be administering medications and interventions. They're going to be intubated, not intubated. They're going to be sedated. They're going to be anesthetized. Anesthetized. So you're not going to actually converse with them. Now, if that's what you want, by all means, go do it, because CRNAs are highly specialized and some bad mofos. No question about it. They definitely know their job. And when I need help, guess who I call when it comes to airway? 1-800-anesthesia. And usually the nurse anesthetist shows up, and they're the ones who are the experts with the airway. They teach me a lot. But they don't do what I do, and I don't do what they do. And I guess what I'm trying to say is you need to know yourself. You need to know what you're going to enjoy, what you're wanting to get out of your career, and what will make you miserable. Quite honestly, it's that whittle it down. What's going to make you miserable to not want to do your job? Don't say shift work. Don't say the nights or the days. Don't talk about all the peripheral things that every position in healthcare is going to have. Think about the details of the job, the specific details of what that particular role is going to do. And you're going to have to whittle it down a little bit more when it comes to nurse practitioners, because they are highly specialized. I don't work with pediatrics. I don't work in primary care. I don't work in women's health, psychiatry. I don't work in a clinic. I work at the bedside in an ICU. Very specialized. But that was my choice. And I did that with complete intention. CRNAs, completely different scenario. You also got to think about job opportunities, where you're at. Is there going to be jobs for you when you graduate? Will there be CRNA jobs for you in your area or wherever it is you're going? Will there be nurse practitioner jobs in that specific clinical specialty? If you choose to be a nurse practitioner in acute care, will there be an acute care job out there for you? If it's primary care, will there be a primary care position in your area? Just because you want to do it doesn't mean it's going to be there for you. Okay? Share the vlog and pass it on! And as always, check your own pulse first.